Right now, the Ministry of Health and Wellness uses the Belize Health Information System to track health data, but it doesn't include information from all the health organizations across the country. That's a big gap when it comes to making smart decisions about public health. To fix that, the ministry has teamed up with the Pan American Health Organization to host a 2-day datathon. It aims to bring everyone together and work towards a single unified platform where all health data can be shared and used to guide better policies and services. Leading the charge is Dr. Andre Schell, the Director of Policy Analysis, who says this is a big step towards a more connected and informed health system for Belize.
The main objective of this datathon is actually to put the Ministry of Health as the steward of health data governance, right? So we are trying to look now at digital health transformation. We're all moving towards that digital era of, modernizing our health system. So we as a ministry now, we have that mandate to actually ensure that whatever data we receive meets the quality too of what we need, and that data in turn then will inform our policies, our actions, which then translate to the better health outcomes that we want to give to the entire Belizean population.
In September 2024, the Ministry of Health and Wellness launches Clinical Data Exchange Platform. The web-based system provides access to institutions and organizations across the country to input key health data on a single platform. Digital focal point at the Ministry of Health and Wellness, Juan Carlos Sarabia, shared more.
This datathon that we're doing for these 2 days, helps a lot because, it's also to introduce to the different stakeholders and the different ministries and units that we do have a system in which, interoperability and data exchange can really happen. And it's not just the exchange of data, but also being able to create dashboards, reports, and KPIs for the different institutions and the Ministry of Health and Wellness. Having a full understanding of what's going on in the country, specifically for health, it's good for us, and this system do provide us with the capacity to be able to report in a timely manner.
Being that this is the first public health datathon, of course there will be more collaboration with PAHO and these institutions, but a long-term goal that we have is to create that multi-sectoral collaboration, to strengthen that multi-sectoral collaboration, because as I mentioned, it's not only the job of the Ministry of Health, but of all our partners that are here today. Our hope is really to strengthen the health data governance, to strengthen digital health transformation.
So what exactly are public health experts collecting when it comes to health data, and how much of it should be shared on one national platform? That's a big question at the center of this week's discussions. Of course, some people might be wondering, is my personal health information safe? It's a fair concern, but according to Sarabia, there's no need to worry. Security is a top priority.
So the CDEP was built with a very secured, platform, meaning that different institutions or organizations will need to subscribe to it in order for them to be able to access data. And it's not just accessing data, but it's what agreement can be made with the Ministry of Health and Wellness on what data can be shared about the patient. The way the system was built, I can speak a lot about it. It's being hosted in the C2 network. It's difficult for any data breach to happen. They have high security. And also, the CDEP does come with user access, authentication, and audit, meaning that we do control who is able to access the system, when they're able to access the system, and even audit, meaning that we control what the users are doing with the system.
Dr. Schell made it clear the big goal here is to make sure the ministry takes the lead when it comes to managing and protecting the country's health data. Reporting for News 5, I am Paul Lopez.